Good morning, everyone. How are you all this morning? Good. You'd rather be in your office? We appreciate the honesty. So today, as Ms. Fox would have said, I am Felicia McLean-Robert. This is my colleague Kimberly Gilbert. We are both at HIV and AIDS Advocacy Officers at the HIV Workplace Advocacy Unit Ministry of Labor. It's a mouthful. The mandate of our unit is to advocate for the National Workplace Policy on HIV and AIDS. Are any of you are familiar with this policy? No. Okay. You are familiar with it. Okay, great. So that is one of our objectives for today, to raise awareness of the policy and of course discuss the follow-up in terms of our role working with you to advocate for this policy at your various organizations. The other objective would be, of course, to provide information on general HIV and AIDS. And we want to have some fun doing it. This is not going to be a lecture and you just sit down and listen. We want to have some fun. This is a free space, if I should say, open to ask questions, share what you've heard, your opinion. We really want to get what we know out there and correct some myths if there are any and just provide general information. We could do that? Okay, lovely. So we have an activity starting off, but I have about 10 persons, 10 persons. No harm will be done to you. 10 persons. I have one. One more person. Disclaimer, Ministry of Labor will not be responsible for anybody that consumes the liquid in this cup. Do not smell, do not ingest in any way. Right? Lovely. You can show the person as well. Other than the type of cup, does the liquid look any different? Right. So the people online, they're saying no. I'm gonna play some music, and what I would like is for you all to share the liquid in your cup with someone else and vice versa. But make sure and have some liquid in your cup. Don't give it all, right? Just stop, but don't give it all. Ready? So when the music starts and stop, that'll be the length of the activity. Any questions? Okay, let's go. If you heart my anywhere you come from, put your up, you could have down blessings on my nation. Oh, some people still going. All right, the party and done for some. Party is not done for some. Interesting. How was that activity for you? Normal. Anybody didn't want to do it? It was good. Anybody did not want to do it? You can show by a raise of hand. Why did why did you participate if you did not want to do it? That's right. I participated because you said to do it. I said I would like for you to do it. I didn't say you have to. Right. You were shy. So did you give to anyone? Did you receive from anyone? Okay, so she participated, although she was shy. And I just want to say that consent is a thing. So if you don't want to do something, you don't have to. And you need to make that known in a very certain way. Understood? Because no, I don't want none and your cup here is a difference from no, I don't want any and your cup is covered to your chest. Right? So Consent, we'll keep that in the back of our mind as well. Good. Looking at your glasses, you're seeing anything different? Right? So some may have more than others, and that's fine. We come in different shapes, sizes, heights, and everything. So what y'all think y'all did just now? Anybody? Right. So she said swap fluid. You share the virus. Now just a correction. Hold on. Talk to the people online.
So what I understand from this cup, right? It represents to me that if someone who is contracted the HIV virus and go ahead sleeping around, like how we pass this cup around, like how easy it will spread.
We have some bright people in the room. I love it. I love it. Right? So that is what it signifies. Because I think there are 10 of y'all. 9 people had water. 1 person had vinegar. So whoever that person shared with, and that person shared with, would have contracted the vinegar. Yeah? Good. So look, the sniff in the cup. So let's see. So Kalisha here has a bottle with blue liquid. If it turns pink in the cup, it means that you would have had some form of the vinegar in your cup. So you've seen some pink, one blue. So you can turn around. You can turn around. Everybody see what you got. All right, we're sharing our results here. I'm glad you get through now because if and you didn't want to do it, right? So we could show the persons behind us the cup. So far we have 2 people, 3 people who are mostly blue, and everybody else, okay. And so we're pouring this liquid in just to to see what it is. Okay, perfect. Perfect. Now I'm just gonna call on a few people to line up so we could discuss this quickly. You could stand here, please. What a couple looking at. Can you come up, please? And the difference in color. Oh, I really like pink. You can come. Okay, great. Everybody else, you can have a seat, please. You'll take your cups in a bit, right? Or if you want, you can rest it down where your foot wouldn't knock it. This one here? Uh-huh. This. Okay, yeah, come. You can come. So we'll swap. Thank you very much. But let's be happy for her for a moment. Because she didn't want to, but she did. And she seemingly gets away. I would deal with that. Right. So we see a difference here, right? So we all looked at the cups and saw no difference initially in the liquid. Can you look at someone and tell if they're living with HIV? Just as we looked at the cups and we couldn't tell. However, how do you know if someone is living with HIV? They get tested, exactly. And that is what we did here by pouring the blue liquid in. We get tested, and we would have identified that some persons did contract the vinegar in their cup. Yeah, right? So here we have somebody that is clearly tested positive. We have someone here who also tested positive, but we see a difference in the colors. Now, what it can be, let's say, as Mr. Simpson was talking about earlier, persons who actually take their medication as they should, this person could bring down the amount of virus in their body because they're adhering to their medication so much so that they cannot pass it on to someone else. Are you all familiar with that? That is called viral suppression. That is why that's one of the reasons why we should not discriminate against people living with HIV. Because living with HIV does not mean you can transfer HIV to somebody else. If you adhere to your medication and the doctor says, okay, you are now virally suppressed, untransmittable, right? But the doctor must say that. We also have somebody here who is not living with HIV. So this person and this person can come together and say, hey, let's have a family. We love each other and have this person stay negative because this person supports their partner. Hey, you take your medication today, it's 3 o'clock, what's going on? How you feeling? You know, people living with HIV need support. We also have babies that she may make that would also be negative. You understand? And that's how we have prevention of mother to child transmission. Same thing applies in relationships, right? Because we need to get them to that point. Now, reason why I say you probably ain't get away, even though you look like her, we have a window period. So let's say you get involved with someone living with HIV and they go and test in 2 weeks, it's going to show up negative. Your body has not produced the amount of antibodies that it needs as yet to show up positive on a test. So while you might think, yeah, I get through, it might be a month and you still test negative. You have to test at least 3 months after, 3 to 6 months after, to ensure that you are the status that you get initially. So just to know what exactly your status is. Any questions? Yeah. Hold on, take the mic so the online person.
Okay, in respect to persons who are living with HIV or AIDS, because we know there's a difference with the HIV and AIDS. HIV is the window, it's the virus that, right, and it could open up a way where other STDs, if the person contract other STDs without medication, it could lead to AIDS. Oh, okay, all right, back to my question. If someone with HIV sneezes or cough, many people have this kind of homophobic attitude, judgmental attitude in society. They think like, oh my gosh, this person sneezed. I could get COVID or I could get HIV or I could get something. Could you all explain to us, could someone with HIV give someone a disease because they cough or they sneeze or they drink from a cup or something like that?
What the modes of transmission to HIV? Sorry? Right, so sexually transmitted, how else do you contract HIV? Blood transfusion, how else? Sharing needles, perfect. How else? And I mentioned one, yes, very perfect. Mother to child transmission. What body fluids transmit HIV? Not saliva. Semen, perfect. Blood, yes. But if you have sores in the mouth, what's going to come out of those sores? Blood. So we have blood. Yeah. You have to have a substantial amount of blood coming out from your mouth for the next person to get, but not saliva. You may get another STI trigger thing, but not HIV. Correct. So we have blood, we have semen, two more. Vaginal secretions, lovely. Last one comes from a female. Think about the previous question, all the answers to that, and you'll get the last one. Breast milk. Whoever said it, you? She? Perfect. Breast milk. So blood, breast milk, semen, vaginal secretions, those are the body fluids that pass on. So when you cough, think of anytime you have to think about HIV transmission, even the risk based on activities, think about what body fluids are you exposed to. And that will determine your level of risk. Thank you all so much. Yeah, what are the ports of entry on your body? Not your nose, not your nose, your eyes. So we have the eyes, mouth. What are the private? Vagina, penis. One more, anus, and of course an open cut or wound. So eyes, mouth, penis, vagina, anus, and an open cut or wound. Those are the ports of entry that those fluids must enter in order for not your nose. So if you sneeze, the person have COVID, you might get COVID, not HIV. So I just want to say for HIV transmission, whether it be mother to child, sexually, needle, transfusion, or whatever, there are 4 factors that must be present. The first one, you need the virus in a human, right? That must be present. 2 persons who do not have HIV cannot Even though there's nobody involved with HIV, it cannot be there, right? So you need the presence of the virus in a human. You also what about a mosquito? Lovely, good. So you need the presence of the virus in a human. You also need a point of entry, which we just identified. You also need infectious body fluid, right? That has a high enough viral load or the amount of virus, because I would have explained the viral load here. So if there is blood, but the blood doesn't have enough HIV to infect, it will not infect. If there's semen and there isn't enough to infect, it will not infect. The fourth thing that you need is exchange of that body fluid. Because somebody could pour infected blood on you, it would not go through your skin, it doesn't go through your pores, and you will not contract HIV. However, if there's a way for it to enter you, then there's an exchange and not going from one part to the inside of you, then you can contract HIV. So those four factors must be present. If one is missing from the equation, HIV cannot be passed on. So if you don't have a point of entry, you don't have an infected person, you don't have a high enough viral load, it would not, you don't have the exchange, it wouldn't happen.
So now we understand this because it have taboos where, for example, persons speak about bananas being injected with HIV or water being contaminated, all these things that you hear as rumors. So it is really wise that you all came to teach us this so we could teach others as well.
Yeah, and if you all want, we can come to the organizations that you all represent. I know we've done sessions with Tactical, so I'm glad to see Tactical answering a lot of questions, right? We've done sessions and we're willing to do more sessions so that persons get a better understanding of how the virus operates, how it's transmitted, and that type of thing. We'll discuss that later on in terms of the follow-up, in terms of our role going forward. What do you all think about two persons who are living with HIV in a sexual relationship? You raise your hand and I'll bring the mic. They should be fine because they already have it, nothing to worry about. Once they're taking the medication, very good.
I've heard people said this that, and I want to know if it's true, that if someone is living, if two persons live with HIV and one viral load is higher than the other and they are both undetectable, could it put the one who is undetectable at risk viral load to go up? And could it increase their chances of death faster than the person whose viral load is higher?
If they're both undetectable, then you have no transmission happening, right? And that's why I tell people living with HIV, I think, need to be more cautious. Maybe than people who are not, but at least because your immune system is already compromised. And if someone, like, and I'm glad you introduced that, if someone is living with HIV and they have sex with somebody, unprotected sex with someone who is living with HIV but may not be undetectable, it can affect their status. And there's a term called reinfection, whereby although that person will be on the medication, they're undetectable and whatnot, introducing especially a next strain of HIV into their body can affect their treatment. It can affect their treatment. And if there's issues with the treatment, then of course their immune system would become further compromised. They may lose their viral load suppression and that status of being untransmittable and become transmittable. There are different complications. So, and Mr. Simpson had mentioned earlier, people tell people, well, is there medication for that? It's not that simple. It's not that simple. That's why we have there's medication and medication helps. But there are still little rules and guidelines at which you have to operate within that. Hold on.
Money. You all have ever come across any cases where, like, you all say it are people who are untransmittable, right? But you all have ever come across any cases where somebody untransmittable with somebody who do have the virus, but yet still the person end up getting it?
Repeat your question.
You see, you all say that it have certain people that be untransmittable, which mean the viral
load
is low.
Mm-hmm.
You all ever come across a case in a situation with somebody like that and somebody who do have it, but yet still the person end up with it?
I cannot say to the we didn't do the study, But a study was done with thousands of what we would say steroid codon couples, where one person is positive and the other isn't. And they being undetectable. And this is why we can now say that if you are undetectable, there's close to no chance of you transmitting. Now it is because the medication and everything is man-made, you cannot say 100%. But it is near 100% in terms of there being no chance or very low risk of it being transmitted. If it is transmitted, then it means the person's viral load will have increased, so therefore they cannot be considered undetectable. If you're undetectable, your viral load is low, you cannot transmit. And of course, in terms of viral suppression or being undetectable, individual is responsible to maintain this. If they choose for any reason to play with their medication, to play with their treatment in terms of adherence and start skipping, then they are allowing the virus to pick up speed in terms of its multiplication. So their viral load could increase. They could lose that undetectable status and now be transmitting HIV.
Good question.
Any further questions or anything you'd like to share?
We have one here.
Does all HIV test positive negative, or if someone takes a HIV test and it come out inconclusive? If all HIV tests come out negative or inconclusive, what do you? I'm not sure I understand what you mean because okay, some people say they'll take a HIV test, right? And it doesn't come out. So if you think about somebody who is living with HIV, taking an HIV test and it doesn't say negative. Is that inconclusive or they got a false negative?
No, inconclusive.
Inconclusive? Well, in that case, they would have to repeat it. And
So
every time they repeat it, it says the same thing. What kind of test they're doing? The rapid test at the health center?
Yeah.
Then I would advise them to go further, and they should have been advised to go. Well, it's man-made. Not to say that we can't trust it, but it's man-made, so nothing man-made can truly get 100% clearance. But in those cases, they should have been advised to go and do further testing if that keeps happening, because it's not supposed to. As part of the HIV testing at any facility, at the beginning of every testing day, quality controls are done to ensure that your kits are working, the fluid that we use, the chasers or the buffers are working. If when we do that quality control, something happens and it's off, you stop your testing for the day and you report it. So if that particular individual keeps getting inconclusive, something is wrong, they need to go and do further test. Any other questions?
What is the relation, or if there is a relation between HIV and HPV?
I would say under the same category in terms of being a sexually transmitted infection, but you can't get HIV from HPV. You may be at a higher risk to get HPV if you have HIV because of what HIV does to the immune system. What does HIV attack in your body? Your immune system, which is your body's defense against any illness, bacteria, anything foreign that comes in. So your body, your immune system is already compromised, putting you at a greater risk to contract any other illness. So when you mentioned before in terms of other infections, and my colleague would have said opportunistic infections, this is another phrase that we usually use for persons who are living with HIV and AIDS. For someone who has progressed to the stage of AIDS, because you don't get AIDS, you cannot transmit or contract AIDS. HIV is the virus that causes AIDS. If you have reached the stage of AIDS, you have a high viral load, you are at greater risk now to get opportunistic infections, which could be TB, pneumonia, other STIs, because your immune system is even more compromised than if you only have HIV. So it's not to say that HPV could give you HIV. If you have HIV, you could be at an increased risk, yes, but only because of your compromised immune system. And that's why my colleague would have said to persons who are living with HIV should be even more cautious in terms of their partners and their sexual behavior. They have to be mindful in terms of what they do, and especially if they are not adhering to medication as they're supposed to. Their medication now takes the role of the immune system in terms of ensuring the virus is kept low so that the immune system can function to the best of its ability. Any other questions?
We have one and two, right? I think I'll stand in here and then I'll come.
Morning. She raised the issue with HPV. I was reading in an article the difference between HPV and HIV is that whether you use a condom and a person have HPV, is this true? That you could still contract the disease?
Yes, and I would have said similar in terms of we all may have some form of HPV because we are different strains. Some of which, just like it has good bacteria, bad bacteria, some of the HPV strains may not be as deadly or severe as others. So at some form they would have said we would contract HPV and we may not know. Your body just deals with it.
So there are over 100 different strains of HPV, and about 30% of those you can get on skin-to-skin contact. So notice that a condom mostly covers the penis down to just the head and the shaft. The areas around that is not protected in a male condom, right? A female condom, you get more coverage over the vagina. Now, HPV causes cervical cancer, some of the strains, and then some strains cause genital warts, right? So depending on what you may get, the genital warts, maybe there are some strains that can be passed on with just that contact. And because male condoms are our common source of protection and not so much female, kind of limited in the amount of surface area that it actually gets protected. Good question.
Good morning, everyone. Before you have been told that things that like pneumonia and other regular sickness with the breakdown of the immune system. Now at present, what is the more common diseases a person like to get with the breakdown of the immune system due to HIV? What are the most common ones right now? Present?
It depends. I mean, it would have to be, of course, in terms of, yes, the immune system. So pneumonia would come out of a cold that they would have gotten in advance. TB, if you come in contact with someone who has TB, well, then you put yourself at risk. There are certain types of cancers that you would also find in persons who have progressed to the stage of AIDS. But to say most common ones, it would still be like pneumonia, TB. They may, depending on their sexual behavior and their partners, you may find other STIs as well.
There's a lot of work also being done around HIV and hepatitis. Hepatitis seems to be one of the more common ones, and as Kalisha mentioned, TB, tuberculosis. So from my involvement, what I've seen so far, those two have been the more common ones, hepatitis and tuberculosis.
And we also call those two, HIV and TB, we call them the twin epidemic because most times they go together.
Yeah.
And as it being an opportunistic infection, let's say you for some reason test positive for TB, but at that point your HIV status is not known. As far as you're aware, you don't have HIV. But if you test positive for TB, they would automatically advise you to also do a HIV test because they know it usually goes together. They would ask you to do an HIV test just to be sure.
Again, not normal, not regular HPV or sexually transmitted disease I'm speaking about, and I'm talking about regular disease in the society now. Yeah, like my COVID, if the person is more susceptible to COVID. If
HIV being
if their immune system breaks down so much that any little disease you could observe that person moving around with.
well, anything they would be at risk for anything once the immune system has really reached that state of compromisation. They're at risk for anything. In terms of COVID, we need to understand and we need to put it out there that persons who are living with HIV will not at a higher risk of contracting COVID than anybody else who doesn't have HIV. As long as they are on medication and their immune system is okay, they are hearing as they're supposed to, they won't at a greater risk. If, however, they were not on their medication, because of the compromised state of their immune system, it would be easier for them to contract it, yes. Any other questions or comments?
In terms of the HIV virus. If a person with HIV contract COVID, what is the chances that they surviving COVID?
That's
I
an individual thing.
yeah,
Just like what everybody is saying, because you have people who COVID affected different people in different ways. I contracted COVID and I was just tired. I was just tired. I'll walk to the kitchen and like, oh my God, where is my bed? And then there are people who are on the hospital bed. So it depends on your body. It's an individual thing. It is not standard. This person living with HIV, they get COVID, this is what will happen. It doesn't work like that.
and even in terms of the virus, HIV virus itself, it attacks persons' bodies differently. So I can have HIV, and God forbid, I can have HIV, and in 6 months, that's it. Somebody else will have HIV, and no one, 2 years going, they're living strong and going. Because their body, their lifestyle is allowing it until something happens and the viral load increases and it starts to show. But it really comes down to the individual.
In reference to the workplace policy, is that a legislative document or is that from company to company? Persons can have the company have some sort of policy that enshrined within their workplace.
Lovely question. I'm glad that you kind of pushed us in that direction to jump into that segment now. So the National Workplace Policy on HIV and AIDS, the second of which was Cabinet approved in 2017. We don't presently have legislation to support it, but it is a national document. It was Cabinet approved. What we have to support presently is the Equal Opportunity Commission and Equal Opportunity Act, where persons can seek redress through that act. So if they were discriminated against in any way because of their status, they can go to the EOC and get redress. We recently conducted, 2 consultations, one in Trinidad and one in Tobago, on legislation, whether or not we should have new or if we should amend an existing act or legislation to support the national workplace policy. We have a
So further to that question, that is why it is important that we have it in the policy enshrined in our collective agreement. Because as you know, the collective agreement would supersede most acts. So once it is enshrined in the collective agreement, that by itself would make it law in your workspace environment. Right?
The Occupational Health and Safety Committee charged with the responsibility of making policies in the workplace for occupational health and safety. One of the ideas is that the committee could draft a policy on the same equal opportunities for HIV in the workplace. So that is one of the initiatives our section plan to do when we go back to the meeting, the OSH meeting, is to get them to, we have a policy and preparedness committee, is to get them to draft a policy to cover the people who might be affected by this virus in the workplace.
right. And just to add to that, in terms of what Mr. Simpson would have said, even though it is not legislation, as I said, it is a national document. So even if an organization doesn't have a policy for themselves, the national document and what is stated in it can be used. But it would give the organization a better footing, and I always say it could prevent them even from liability in terms of knowing what should and what shouldn't be done. If you don't have a policy, or if you refuse to have a policy, as some organizations may willfully do, I mean, you're putting yourself to be liable because it therefore states you don't want to comply by what the document states. We have organizations that would have terminated persons based on their HIV status. And they outrightly continue in terms of not wanting a policy and even in implementing measures going forward to ask persons to test or to ask them to disclose their status, which is wrong. So after discussion, we go into the policy aspect.
Yeah, it's with reference to what you're speaking about. Seeing that Trinidad and Tobago signed under the ILO conventions, I can't remember the number, what we learned in UWE this semester. It's in respect to discrimination. And the same thing that you all are, the same things that you all are speaking about, seeing that we signed to the convention under ILO. Is it in line with that? Why the policies are being implemented?
So the National Workplace Policy Let me rewind a bit. Our unit came out of a study that was done between 2005 and 2008 with the International Labour Organization and the US Department of Labor. Two of the findings out of the study was one, the highest rate of infection was between 15 to 49, which is our workforce. The other finding was that we had high incidences of stigma and discrimination at the workplace, HIV-related stigma and discrimination, both of which threaten our economy if we did nothing. Hence, our unit came about and its policy, and of course, the further advocacy for organizations to develop their own because it can have differences in certain areas and, of course, the different sectors of our workplace. So there are 10 principles, and they will have came from the ILO's recommendation concerning HIV and AIDS at the workplace. So the policy, the framework for the policy was the ILO's recommendation. And this is what we go by in terms of organizations developing their own policies. They must have those 10 principles. You cannot pick and choose which principle you want, and then you only have 2 of them and call that a policy. That will not stand, we will not approve it. 10 principles are what the policy has.
We will go through those principles now so that I'll just ship it. We'll go through these now so that you can understand what the principles are. And remember, they are also rooted in human rights.
One for him as well. So the first of those principles is recognition of HIV and AIDS as a workplace issue. Some persons may think, why are you even coming to talk about that in the workplace? My sex life is my business. What I do is my business. That's not your own. But it is my business if, God forbid, you were to contract HIV or just a rumor to spread, and then there's a protest in the workplace, they go by HR or they go by the trade union rep to demand that you are terminated or something be done because you are putting me at risk. It becomes a workplace issue. My workplace production levels would be affected. Also, we take advantage of having the amount of persons at a particular workplace. We spend most of our time sometimes at the workplace, more than we do at homes in even some cases. So recognizing it as a workplace issue and treating it as such really helps us to effectively manage HIV. And I say effectively manage because some organizations may think I am managing by eliminating the threat and terminating this person. That is not management of HIV at the workplace, and for sure that is not what we want. We have prevention, ensuring that there are strategies, there are measures being taken by the organization to ensure persons have the information that they need, and even, if I should say, material in terms of condoms. Not all workplaces. Some workplaces even provide condoms to their workers, not to be used at the workplace, but what you do outside of your workplace, again, can impact impact the workplace setting. So having sessions like these, as my colleague would have mentioned, as part of our follow-up going forward, we would be liaising with you to come at your particular organizations to do sensitization sessions. There are lots of myths out there concerning HIV and AIDS. And we need to combat these myths, in terms of addressing stigma and discrimination. If you have the accurate information out there, you can mitigate the impact of stigma and discrimination, and even in terms of transmission. So that's prevention, and there are a whole lot of other strategies we can take and implement, and we could work with you to implement at your workplace to ensure it is prevented at a workplace level. We have confidentiality. No employee should be forced to disclose their status or that of any other employee. There should be no probing questions, nothing of the sort in terms of them finding out what is your status. That is not important. If, however, the employee chooses to disclose, whoever they choose to disclose to should keep that information private. It should not then be going shared with another person, and then before you know, the whole organization is aware and you are now being discriminated. If it is disclosed to someone in HR, and if it's disclosed, let's say, via a document, workplaces should ensure there are different files kept. This file should not be in the normal cabinet where everybody in HR has access to. It doesn't even have a lock, so anybody can pull the drum, go and look through your file and come to know your status. That should not be. It should be kept in a confidential area, in a confidential file. So these are things that can also be implemented at organizations to ensure that the person's status is protected. We even go further to ask some persons to implement what's the
Grievance?
point? Huh?
Grievance?
No, like a non-disclosure, something when they come into an organization, you sign a
Oh,
document
confidentiality agreement.
basically stating whatever information you come to know there, it remains that you are not to disclose in any way. So these are the measures and the extents we go to ensure that persons are really, their rights are protected in terms of privacy and confidentiality. No testing for the purposes of employment. An HIV test should not be a requirement for anybody to do a job. Now, there may be some exceptions, and I'll address it. But HIV testing should not be a requirement for anybody to be employed or promoted. As long as you are medically fit to work and you are qualified for the job, your chances of getting this job should be as clear as anybody else. So your status that should not have anything to do with it. Much more for them asking you to disclose. Now, Mr. Simpson would have touched on the CPU having a policy. Now, even though the public service may have a policy, we still have a rift within our home in terms of the public service, whereby there is still a ministry or an arm of a ministry that still requires HIV testing for employment. We are presently in talks in terms of addressing this to see how best we can work around and even have it removed. But apart from that, the public service does not require persons to do HIV testing.
Most of you are not aware that even though they are workers, they are not considered workers within the meaning of the laws of Trinidad and Tobago and international members of the defense force. And if all you want to think, remember them had a worst reputation in terms of playing this telephone, all right? So be guided by that. And there was a question you asked earlier on in terms of the legislation. In the Industrial Relations Act, it tells you that you can bring a matter for employment or unemployment or refusal to employ and whatnot in an organization. And in that, because the ILO, which we subscribe to, we signed out on, they have a recommended list of all the measures and things that an employer should take or should abide by. We can use that in grievance and dispute matters when we carry it forward to say, well, look, the employer was wrong when they discriminated against you by refusing to promote you or to employ you and whatnot. All right? So,
I want to also add that even within the defense force, there are persons who, after getting the job, being on duty and whatnot, would have contracted HIV. They are not dismissed. Thank you. They're not terminated. That's what I was looking for. They're not terminated. Rather, they take care of them. And care and support is another key principle, as you can see there in the brochure. But employers can provide certain accommodations, reasonable accommodations for their employees. They take care of them, but they just don't take on persons or intake persons living with HIV. I guess for them, it's a level. What they say is that they've already exhausted our expense and put money into this person. They've trained them. They've done this. They've done that. They've already put that out, so they take care of them.
And even apart from their resources they will have spent on that person or put into the individual. I mean, just terminated because or solely based on that person's status, right? They put themselves at a liable position. So they really can. The other arms in terms of prison, police, fire, they don't test for HIV as part of their recruitment process. But defense force, they are standing on that position that testing is required, and if you are tested positive before, you will not be recruited. We would have just had a meeting actually. No, but actually, some internationally, they have actually allowed to allow persons into the, I would say, the regiment first, even if they have HIV, but there are stipulations. You must be And you must ensure that you are more or less healthy. You are undetectable, you are adherent to your treatment. You cannot come in and you may play in the pool and your viral load is high. So internationally, I know like in Australia and I think even the US, they would have started allowing persons into the forces even if they have HIV. So
Never
Trinidad, just we're kind of behind on some things and just reaching up to that same level.
But I'll just ask this main one. Seeing that the Medical Research Foundation or Center is one of the places that many people go to test or they will actually have the information on all the persons who they have the record of who have HIV. Based on confidentiality where the workplace is concerned, are they privy to disclose their patients' information to the workplace?
Definitely not. On no basis should anybody's HIV status be disclosed. There's only, if I should say, one exception, and that's in the case where, let's say, in terms of counseling, you would have disclosed to the psychologist or somebody that your intent is to willfully transmit, then they could seek and refer in terms of ensuring that this isn't done because you should intend that you willfully transmit to someone else. But other than that, you cannot disclose anybody's status. And that's what we need to do is at the health center. And this is a hindrance at times the person's even going to start. Because some it's talk in our culture. Persons talk and this is wrong. No.
Even within MRS, Medical Research Foundation, they do have that confidentiality agreement that Felicia mentioned earlier. So persons who work there have to sign that. So we did a study with them recently and we interviewed some persons and we too had to sign that confidentiality agreement. Good morning. This one is about the defense force. I'd like to believe that because their training is way different from the others, like it involves cuts, open wounds per se. I think that would be the reason why
That
they'll
is one
continue.
of the things they would have gave, but in terms of the other countries who would have allowed it, it's the same training, same rigorous training where cuts could happen and whatnot.
But also that HIV is not the only bloodborne illness that we have. So if you do have cuts, there's still some measure of treatment and so forth that needs to happen if there's that type of exposure, right? And also to mention, as I say exposure, there's post-exposure prophylaxis that is also available at public health facilities. So if someone, let's say, for example, someone is raped or there's a workplace incident, they can go to the health center and you can put this in your policy as well, a post-exposure prophylaxis protocol, where that person is taken to the health facility and they can be assessed and then administer the treatment for the first 28 days. They give them the medication, then they test them again, and that person is observed for 6 months. So in the incident that something may happen at work or whatnot, there is also that. Sure.
In terms of days,
Right.
how long after the incident that they need to go and get treatment for?
First 24 hours is ideal, but you do have up to 72 hours. After that, the medication will not work. Well, any exposure. Our culture is way different from international cultures, right? We do not believe in going to the doctor for anything. We self-medicate.
Especially our men.
Our couples, they believe that because I am faithful, my partner is faithful, I do not have to test, and I do it every 6 months. I don't care. I don't know what my partner is. I don't have a partner, but when I do, every 6 months. And because of that, I think it's still wise for them to do the testing because we don't do it.
No, and I'm glad you said that because that brings me to the exception. There are some organizations, different sectors, for example, oil and gas, that may be more high risk than an office setting. So they may do medical and it may include HIV testing. What we don't want is that the result of that HIV test determines my employment status. If you are telling me it's part of the medical and we work with you to ensure that you are on medication, you're enrolled in treatment and care, okay, that's fine. Because some institutions do it. But don't tell me you're doing it and based on the result, that person will be terminated or not employed. Yeah.
And whilst you were speaking earlier on, one thing I would like to stress on is that these seminars are also important in the workplace because in this modern day society, there are still people who don't have the education and the knowledge about using a condom and the the various methods to prevent the transmission of HIV. So this is really extremely important.
Yeah.
And we'll be shocked to know that, in this modern day society that does exist.
And the principle of prevention is what would really add to us in terms of engaging the workplaces. My colleague touching on PEP would have also introduced, I would say, the topic of a safe and healthy workplace environment. Because even including the Occupational Safety and Health Act, the employer has a responsibility to ensure that the workplace is safe, the employees are safe. So even if an incident happened and there's blood exposure, as my colleague would have said, you treat all blood as if it's infected with something. And employees need to be aware of this. Yes, we may see our colleague in danger, and we may rush to help, but you don't know what they have. They may not even know what they have, and it doesn't have to be HIV. It could be some other illness that can be transmitted via blood. So having these protocols and these guidelines in place and having employees aware of these guidelines, not that you could force them to read it, but send it out in an email, have little snippets around the office. All of these are strategies that can be implemented to ensure that the information is out there to prevent transmission at a workplace level. The PEP protocol, having it also included is very good. And having a link as well to your nearest health facility in the event that something happens. A call could be made. You have a contact person or a focal point. A call could be made. If we had an incident, expect so say no of the long journal way. And action could happen instantly.
More importantly, because at our workplace, we just had a whole health seminar for over a 2 week period. On our establishment, we have over 1,000 plus workers. The input in workers coming forward was limited for the main reason employers just have health seminars, but the information before the health seminar has never come forward. So workers now will be a little hesitant in coming forward to be screened, coming forward to be part of that health whole week. So what is more important for us to take back from this is how do we share the information when we go back to our workplaces, because our educated person can help share this information we get in here, right? I'm not taking the pamphlet, carry it home, rest it on the table. But I take about 6 because I know I will now go back to the workplace and make copies, give the other officers, and share the information. So I want us to know that when we leave here, the information that we receive is not they give you a book and they didn't write down nothing in it, because there are points here that we have to take back to the workplace. There are information here that we have to go back to the workplace and share, because an educated workplace will also help in the prevention and the fight against HIV.
Yeah, and I like that you share that point because that is what we want you as the trade unionists to recognize. We have 4 officers. This unit Ministry of Labor, three as we just reminded.
There are only 3 of us to
This
do this week.
unit is the only unit that addresses HIV at the workplace level. Ministry of Labor, we deal with the workplace. Ministry of Health, PASU, deals with it on a national level. We focus on the workplace, and there are only 3 officers for the whole of Trinidad and Tobago. So that's why we look for these strategic links with organizations that could further help us do the work, and you can even have greater impact because they listen to the trade unionists on your side of talk. So we want to work with you going forward with your various organizations. All we need from you is date and times, and it could be multiple. That's okay. We will be there. Oh, no, Carib hasn't signed out of you as yet. They would have gotten a visit.
Okay. So the MOU is the memorandum of understanding that you do with HACU. Right? It's not really legally binding, is correct, but it 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 helps to motivate the employer to go in the direction of having the workplace policy. Because in signing the MOU, it would also give you access to training and whatnot. So the personnel will have a better appreciation of what is happening in the workplace because they're not taking that into consideration. And as trade unionists, one of the things we have to push in the head, I'm just telling you all that, is to point out to them the potential economic cost to them if they don't have a workplace policy. Because we know, especially in the private sector, that is what they understand the most. Money and how to make it and how it's possible to lose it. So that is one of our strongest strategies in dealing with them. Okay?
We are part of the Health and Safety Committee at CARB. And what I must say is that our voice as the trade union, part of that, we have a good interaction, but more so because we have moved away from a health and safety committee with trade union and company. We have a health and safety committee where each member of the committee have a voice and each member must be heard. And once you come to that committee with information and the information is relevant and will take the organization in a more positive look, we have a lot of times implement and enact change at the workplace.
So your organization, let me make an example. I would have visited CARB sometime last year, left my contact information. I didn't get a group of video, left my contact information. I still haven't received a follow-up call. So how
Well,
do you
you probably talked to the wrong person when you came.
not spoke to one of the persons in HR or health and safety? Not well. Well, if I say health and safety, it may not be health and safety, but someone in HR would have spoken and left my information.
Rest assured,
It's just a show.
going forward,
The rich we could make and the rich we can make with you all who have a strategic position would be good.
well, the president I know sit here, where you was here this one, right? And we don't know that. So we have a committee designed in the health and safety. There are a few people set up to implementation policy committee, we just call it, right? So we just had to point them in the direction that we want them to go. But more importantly, we'll be giving them the information to go with. So it's less work for them to do to have the policy implemented.
And even as you spoke, I mean, Carib environmental workplace could be considered a high risk place last incidents could happen. So a policy at Carib which became, let's say, besides the incident, let's say there is a worker who's living with HIV at the workplace, they're not adhering for one reason or the other. Are they comfortable to come and disclose? And this could be across the board. Are workers comfortable to disclose? Are workers comfortable to come and say, I need a little time out to go to the visit? And it's not to say persons who are living with HIV are more sickly than other persons. That every week they need to go to the clinic. That's not the case. There are persons who visit the clinic twice, 3 times a year. Once you are adhering to medication, you are healthy to work and comfortable to work as anybody else. However, the issue of stigma and discrimination is crippling. A matter of fact, that is actually even more a risk to them opposed to the virus itself because the medication works.
And just one last point before I pass the mic to Lily. At our workplace also, what we have is a strong union, always encouraging its members to seek redress. And if the community health system, because we have a doctor on call almost 6 hours a day, right? And if a worker need to be referred when it goes to EAP or any other institution to get help of the union ensures that the company send that person or encourage the person, right, to seek redress through other avenues or other agencies that they could get that support from.
Just want to add, Kalisha was saying, if there's someone who is living with HIV and whatnot, but what about the people who are working there and do not know their status? To me, that is quite dangerous. People not knowing their status because it doesn't mean that they're not sexually active. And if an incident takes place, you may not know that person's status, but they could be positive. The person running to help them could be positive. We don't know, but we need to encourage a workplace where people are not afraid to get tested. So just as there's testing going on in this compound, everybody should feel empowered. Oh yes, let me go do that. That is the type of workplace that we need, where people are not afraid to get tested. Mr. Tom Simpson would have mentioned ending AIDS. The only way we could get there is if we know people's status.
There are global targets 95, 95, 95, which states 95% of people should know that living with HIV should know their status. And as the activity we did this morning showed, you need to test. That's number one. Number two, if they know their status that they are on medication, they're not thinking, oh God, somebody go see me coming out of MRS, or my colleague might catch me taking my medication. These are things that phobias that should not be in someone's head, right? Because we want people to adhere to their medication so that 95% of them can become undetectable and unable to transmit the virus. That is where we need to go. But it starts with the stigma, it starts with the knowledge, and then the behaviors that follows. So I know you've painfully been waiting.
In respect to what he mentioned about EAP, and you were also indicating, what if persons in a workplace, that's their privacy, the employers nor their co-workers have no rights to know their confidential matter. As long as they are capable of working, they are not invading on others, like interacting with others in any sexual conduct or misconduct, which could actually endanger another human being or co-worker life. As you said earlier on, and we keep saying it, the employee doesn't have the rights to disclose their information to the employers nor co-workers. Another thing is infringing on others' privacy or confidentiality, or invading their privacy, going behind co-workers' business, the things that you want to find out about them. They're too quiet. They need EAP. Something is wrong there. But you may not know what's going on with that individual. They may be going through some depression, they may be going through something else. And it has nothing to do with the status. But guess what? What if it has something to do with their status and they promote or continue allowing discrimination to happen in the workplace? But the first resort that the employers or HR resort to is send them to EAP because they're being bullied in the workplace, but they're not dealing with the real issues. Where did it start from? Who do you address where discrimination is concerned? Because the worker or the employee did not disclose their information to anyone. So you're not going to try to find out how they start to spread a rumor or whatever. But the fact is, are you addressing the persons who are contributing to the discrimination? And mind you, this could include HR workers as well, management, or co-workers. So how are you addressing that? Are they going to send all of them to EAP?
That's an individual thing based on your organization, and that is why your policy is important. Because under your confidentiality clause, you then have to say, how do you treat with things? What is your grievance procedure? Because I could tell you there's a public service grievance procedure. But when you look at the Ministry of Labor's workplace policy, there is an amendment in terms of how do you treat with those types of matters? How do you treat with HIV and AIDS specifically? And that is something that your policy can speak to. How do we treat with this matter? Is there a formal procedure, informal procedure, and after the informal procedure, you then have a formal procedure? That is up for the company to decide. Another key principle is social dialogue. And that is taken into consideration that there are different people at different levels that need to be involved in the conversation to have that solution, right? So there is, what would be ideal is to have as little people as possible knowing. So let's say, for example, if in a usual situation, you have to tell the supervisor, then the manager, and then the HR person, and then that one, and that one, and that one need to be involved, and the meeting is 10 people. In your amended procedure, you can then say, okay, we can skip this person, skip that person due to the nature of it and to ensure privacy, right?
That's one thing I wanted to include as well. Just as you said, persons who are living with HIV/AIDS and they are employed and they are performing their functions, the employers, if they are aware of the discrimination or they are the contributory factors prolonging this discrimination or victimization towards those persons who are living with HIV/AIDS, they could actually increase these people's mental, they could actually create a mental issue in these people's lives where it could lead to anxiety and depression.
I always tell persons HIV in itself, we always think of the physical, but we don't look at the psychological. You can't see the psychological unless the person exposes But inside of their head, the mental burden that they carry, I don't think we can begin to imagine that every day you live with a fear of someone finding out your status and you then being discriminated based on it. Discrimination hinders persons from seeking treatment because I don't want to be seen going there. Sometimes it doesn't even have to be for you, you're going for a family member, but you don't even want to go. So the psychological impact of HIV is really something that we need to consider and how we, even as individuals, treat with it because at some point in our lives, we may have been guilty of discrimination. I mean, let's be real, it's human nature, not knowing better than because we would have been guilty. But now that you have the information, what are you going to do? As your colleague would have said, what are you going to do with it? Are you going to go home and show the fly on the desk and that's it? Or are you going now to be a voice at your organization to further advocate for the protection of rights and all persons really having that quality experience at their workplace?
Also understanding that because of the stigma and discrimination in society, there are people who self-discriminate. So they're living with HIV and they would not put themselves up for promotion. They may not want to cook the food for the cookout. There are different ways in which people may discriminate themselves before others have a chance to discriminate them. Even that adds to that mental pressure that they may have.
And I want to thank you for talking about that because something I wanted to add to you also, while we're speaking about persons who are infected with HIV and AIDS, persons who are, are affected also suffer discrimination. So it may not be you who have the virus, but a family member may have it. And somebody would know, or somebody would start to talk about it. And they would, because you know we are in Trinidad and Tobago society, especially for those people in Tobago where family units are closer in terms of the workspace. And they would go and they would tell somebody, look, so and so daughter or husband or brother or whoever have it. And she does be in our house there. All of them does be using the same thing and those are things that also affect. And one of the things that we have to ensure that we get into the employer set, because the big talk these days is about productivity. And we have to be able to show them that with the policy in place and by actually implementing it, making use of it, it will help to increase productivity in Trinidad and Tobago. All of us that be hearing them, especially the employer class people. Oh, productivity, productivity, productivity. There are instances of a person may be ill or their relative may be ill and they have to stay home and take care of them. And based on the nature of the work that they do, they could work offline so that they would have more time to spend with the relative or whoever. And you insist that they come into our office to work. Those things can have a mental effect on you and your ability to be a productive worker. You may make errors, especially if you're dealing with calculations. You may make errors and whatnot. All those things affect productivity in our workspace. All right?
I agree with what you said, and I really think that moving forward, as the Ministry of Labour and the other ministries like the Ministry of Health, as well as the trade unions, and that goes for those who represent monthly paid as well, like PSA, all should come together where they could actually make it a mandate where they post the government to enshrine these into the laws, into the constitution. Reason being, it only becomes a law, it only becomes a practice when it becomes a law in your country. So even though we are signed to the ILO, as the young lady said, they only want to consider when they see it in the constitution. So they will hear all the three workers from Ministry of Labour representing all of the work, all the employers, all the employees in Trinidad and Tobago coming to say we want to end discrimination, we want to end HIV/AIDS, but because they're not seeing in the laws, in the constitution, this is a law, they could still continue allowing it because they think that they don't have the education or the fitting to actually deal with the matter.
Just so that you all would know, the HIV board expired last week. I was the last trade union representative on the board. Okay, so just so you could know that there is there has been tripartite discussions so that trade unions are represented on the HIV board along with employers and academics and professionals. Okay, so the advisory board is made up, constructed that way. Further to that, in September, I think, of last year, there was the last consultation, I think, that was held in Trinidad.
The last Trinidad was in September and May was Tobago.
And May was Tobago. All right, so where they have all the social partners coming together, and there has been what I would call a majority call for the standalone registration is what we're talking about when she mentioned about the law just now. So we have been agreeing in the main to the standalone registration to address HIV in the workplace. There are some people who believe that it should really go beyond HIV, and but you see, it would confuse the issue. So hence the reason why it is we asking for the standalone legislation. And that is what is being addressed currently. There is a draft in place, really, and the consultation continues along that lines currently. But you know how the process is in terms of making laws and passing it. But it is ongoing currently, all right? In fairness to the state, I don't like to say the government because there are some things, yes, the government would push it, but the state, those public servants up there who in the main, they help to carry it with us one time. All right?
That's the simplest point there. Because many times my colleagues and I would say that sometimes in dealing with the trade unions, they say us as the government. And we know how at times it could be between trade unions and government. But we are one unit within Ministry of Labor that actually wants to work along and stand on the same side as the trade union, ensuring that persons' rights are protected at the workplace. So when we standing here before you, we're not putting up a front. We really want to work with you to ensure that persons are not discriminated against or their rights are violated in any way at the workplace when it comes to their status and their quality experience at their workplaces. Yeah, only three persons.
Three advocacy officers. There are other persons in the unit like POAs, manager, assistant manager, and so forth, but we are the field officers.
Challenge they have, same as the role that you want to perform. And they put them on contract. I know I have been to this one. Talk about they have challenges in full performance. Higher, so they get about full confidence. That's this month. I think one person left, two people left. Biggest challenge that who wants to do that? You want to go back and get out. You can't go like back and and that is one of the biggest. They are not the only what are the same time.
I also wanted to add that while it may not be standalone legislation, because one of the questions that we ask persons at the consultation, should it be standalone or should it be worked within existing legislation? That is another option, right? Because there are people in favor of either side as well. We have a question from online. Love it. Is the national document available to assist in the construction of policy in the workplace? There are a number of things that are available. So yes, there's a national workplace policy on HIV and AIDS. Our unit also has a policy template that can be followed to develop the policies. And if I know some organizations have a standard with which they do their policy, they can still look at the template and see what are some of the components, but the 10 key principles must be within that. And they have us, because we also go to workplaces and sit with them and help develop the policy. And we also review your policies and give feedback and that type of thing. So in addition to just that document, you do have the support of our unit to complete your policy. Okay. And you do not need a policy in order for us to come in and start to do sessions with your staff.
So at any point in time you'd like for us to come in, we can within that policy development process, that's fine. And just in terms of wrapping up our session, I mean, the key basics of the policy, the purpose of it is to ensure that persons are not discriminated and, of course, to prevent transmission. Our support going forward, of course, there's no cost attached. We review, we assess in terms of developing policies. Just give us a date, give us a time, we'll be there. We provide sensitization sessions similar to this at organizations. Multiple sessions is not a problem. After work hours is not a problem because I know some organizations have shift systems. We really want to work with you as best as we can to support the advocacy at your workplaces. As my colleague would have said, we have the documents there to support. Ensure that you sign the attendance register because we will be making contact with you after to see how best we can work with your organization. Before we go as well, we have some feedback forms that we'd like you to complete. It's not a test. Mhm. Okay. All right. So that wouldn't be a problem. Right. And even I think things like that first, you still have to be careful in terms of you just referring somebody to you because you within yourself, you don't have the expertise in terms of psychology or behavioral sciences to say that something is wrong, but you find this person should go to you. And we would encourage EAP support in terms of like say someone who's living with HIV, disclosing to you, I think I need to speak to somebody, there's no problem then. But not just to be forced on someone.